Healthcare? Well, I've listened to all the arguments. And this is Violet. She was born with a recessed jaw and spent the first month of her life in an intensive care unit. She has a breathing tube and a feeding tube for now, and she requires daily nursing. Her first month hospital bills totaled literally $500,000, and she still has a long way to go. We went to the doctors and the hospitals directed, but still, they only covered her at 70%. There were claim denials and appeals, and then we reached our caps. We were losing our nursing, and we were dead in the water. It looked like we were going to lose everything. Our daughter faced a heartbreaking legacy of bankrupting her family. No parent should have to go through that. You know, what matters most is our precious daughter and the focus on her love and her care, not fear and the crushing distraction of looming financial disaster. Then Medicaid came through in the 11th hour through a special program and literally saved us. Medicaid is what the public option is supposed to be, and that's why we need it. We're covered now, focusing on the things that are more important. So I listened to the arguments against healthcare and the public option, and they just sound cold and beneath us. You know, we're covered if we have a fire or if we need police. And healthcare is a more fundamental right than both of those. And everybody knows that insurance companies make huge profits by denying what your needs are. I mean, the whole point of profit is to give you as little as possible for as much as possible. That's no way to address your health. Can you imagine if you called the fire department, they showed up, and then when they were done, they wrote you up a bill? If they operated on profit, I mean, if you had a fire, you'd be afraid to call. You'd try and put it out yourself, right? People that oppose social safety nets like Medicare, Social Security, healthcare reform, they act like they're never going to get sick. And I guess what it boils down to is, what kind of people are we? What are our values? What matters to us? It's time to act civilized. Like life is worth something. Something special. Something precious. Never mind the pessimism and the scare tactics. It's time for decency. We can make these historic healthcare changes happen. Yes, we can. Right?